And thank you for tuning in today. My name is Taylor Hughes. I'm the Vice President of Policy and Strategy at the Indy Chamber. We are really excited to host this member town hall, member-only town hall, to give you all kind of a sneak preview into some of the BEI work that's been going on over the last year and some opportunities that are going to come up for you all to get involved. So as our slides come up here, we'll get into some of our content here, but many of you will be familiar with the Business Equity for Indy effort. But for those of you who aren't, this effort started in 2020 in response to the COVID pandemic and some of the high-profile killings that we saw of unarmed African Americans in that year. The Chamber's membership board and the membership and board of the Central Indiana Corporate Partnership came together and called for a collective business community response to advance racial equity in Central Indiana. So those conversations began in earnest in the fall of 2020 and really focused through 5 key pillars. So those pillars are looking at hiring and promotions, procurement and participation, learning and talent, impediments to health, and public policy. These have really been organized as task forces that the business community and key leaders in the African American community as well came together on to develop strategies that the business community could employ to advance Central Indiana's racial equity outcomes. So as those conversations have advanced over the last couple of years, we really focused in on what an individual business themselves can do to advance racial equity. What's the role in a company of any size in putting some of those best practices into place? So this morning, and I won't tease it too much, but we'll be talking about an effort that is the hiring and promotions, learning and talent, and impediments to health task forces joining together to put together their best practices, their strategies for businesses, and help to support companies implementing those strategies in their workplaces to advance racial equity. But before we get onto that, we'd like to introduce you all and give a big thank you to 2 key leaders who have been at the center of these conversations and helped to drive them forward. Kyle Weber, the Chief Strategy Officer for Elevance Health, is here, and we'll give a few comments today. Elevance Health was instrumental in funding and supporting the health playbook process and the impediments to health task force over the last 2 years. And then after Kyle, we'll hear from Claire Fidian Green for the Richard M. Fairbanks Foundation, who is a key partner on the Learning and Talent Task Force, as well as an executive committee member of the Chamber, and who is providing financial support for the BEI workforce pilot that we're going to tell you all about today. So without any more ado, I'll hand it over to Kyle. Kyle, thank you again for being here this morning.
Excellent. Well, thank you, Taylor, and thanks for everyone for tuning in today. As Taylor said, Elevance Health and our CEO, Gail Boudreau, have been committed to BEI from the beginning. Some of you might not know the name Elevance Health. For those who might be unfamiliar with that, we were called Anthem up until end of June last year, and we did that rebranding. And while we recently changed our parent company name from Anthem to Elevance Health, our mission remains the same: to improve lives and communities. Our new name is intended to underscore our commitment to elevating whole health and advancing health beyond healthcare for our consumers, their families, and our communities. And our nearly 100,000 associates reflect the communities we are privileged to serve. And together, we're focused on reimagining the health system and taking a more holistic approach to improve outcomes, equity, and accessibility. We know, particularly in the healthcare world, but in all realms of business, in order for businesses to continue to grow and innovate, they must be able to attract and retain diverse employees. The pandemic taught us, and me personally, that employee health is a critical component of being an equitable employer and supporting the success of a diverse workforce, particularly employees who face disproportionate challenges because of race. Elevance Health wholeheartedly supports the focus BEI has placed on supporting small and mid-sized employers in developing and implementing strategies to support their diverse workforce and maximize their company's competitiveness in a historically tight labor market. We think authentic, effective equity strategies are a core component in being an employer of choice. That's why Elevance Health has supported the BEI Health Playbook partnership with IU, which you'll hear more about in a little bit, to outline strategies to support your workforce's health, and in so doing, advance racial equity outcomes for your employees. But we wanted to go a step beyond just articulating best practices and actually support companies with business intelligence, subject matter expertise, promotion, and accountability in putting those best practices to work. We know that health equity, or we know that equity work is central to your values and missions of your organizations. The BEI team is launching this initiative to help remove barriers to taking the next steps to move the needle on racial equity with your employees. And we'd be thrilled for all of you to be a part of it. So that's all I had. Thank you for your time. And I'd like to turn it over to Claire Fidian-Green next.
Great. Thank you, Kyle. And I also welcome you and thank you so much for joining us this morning. And I also want to thank Stacia Murphy and Taylor Hughes and the entire chamber staff for their incredible support for this effort and the BEI effort more broadly. For those of you who don't know about the Richard M. Fairbanks Foundation, our mission is to advance the vitality of Indianapolis and the well-being of its people. And we strive to achieve that by working to address significant challenges and elevate opportunities across three focus areas: education, health, and the economic vitality of Indianapolis. The BEI workforce pilot that you're going to hear about from Stacia and Taylor touches on all three of those priorities. Last fall, the BEI Learning and Talent Opportunities Task Force that I co-chair along with Dr. Adrienne Sims from One America published a report that identified shocking disparities impacting Black students and other students of color in Marion County. For instance, only 7% of Black students in grades 3 through 8 in Marion County passed the iLearn, compared to 34% of white students. In addition, only 50% of Black high school graduates enrolled in college, compared to 59% of white students. The most recent data from the commission show that the Black enrollment rate has dropped now down to 43%. And only 11% of Black high school graduates in Marion County in the most recent graduating class who enrolled in college and successfully graduated within 6 years, that was 11% compared to 25% for white students. These education outcomes are incredibly concerning, and they also translate into disparities in median wages for employed adults. In that same report we released last year, we showed that Black college graduates in Marion County earn a median annual income of $36,000 compared to $44,000 for white college graduates in the 3 years after earning a diploma. These disparities cut across all aspects of education and employment. And these disparities have a negative impact on career trajectories, earnings, and the quality of life for Black individuals and other people of color in our communities. And while employers may recognize those barriers, many are unsure how they can help. We hope that the pilot that we are announcing today will help change that. Through this first-of-a-kind pilot, companies will have access to resources that help them take action to address inequities. In a time where many voices are talking about what should be done, the workforce pilot is providing free expert resources to help resource-constrained companies implement best practices to address racial disparities in the workforce. I'm pleased to announce that we have awarded a grant of $600,000 to support the Indy Chamber's efforts in rolling out this pilot and helping come alongside employers to improve education and employment outcomes for Black talent and other people of color across our region. Now I'm going to turn it over to Taylor Hughes and Stacia Murphy, who will tell you more about the pilot.
Thank you so much, Claire. And thanks again to both Claire and Kyle for your support, your guidance through this process over the last couple of years, and the financial investment that your organizations have made in this work. As we hear from our members, it's so clear that the value proposition, excuse me, is there in the sense that the companies understand that racial equity is important, diverse talent is important, not just because it's the right thing to do, but it's because it's an imperative for business competitiveness. So what we wanted to do is articulate clearly what strategies companies can employ to advance racial equity in their own business operations and with their own workforces, and then to demystify those strategies and help to support companies implementing those by bringing top dollar consultation and subject matter expertise to bear and make it easily accessible for our members. So I will turn this over to Stacia Murphy to get into the program as we are launching it today.
Thank you, Taylor. Hello, everyone. I'm Stacia Murphy, Director of Equity Outreach and Strategic Partnerships for the Indy Chamber, and along with Taylor in providing some support for this BEI workforce pilot. So a little bit about the pilot. One, it's a 2-year cohort and is meant to be an intensive experience designed to assist companies and support them through their journey of adopting evidence-based strategies to reduce outcome disparities and support their talent and business strategies. Who is this for? Ideally, this workforce pilot is for small and medium-sized companies, which is really the core of our membership here at the Chamber. And so again, I think you heard from Claire that we know mid-size and small companies tend to be resource challenged and may not know where to start in employing some of these best practices. And we want to make sure that we do everything that we can to support you along the journey. And Taylor, would you talk a little bit about an example of what the pilot would do?
Absolutely. Yeah. Tia, if you could go to the next slide. So some of the best practices that we've been referring to come out of the Impediments to Health playbook that was finished in April of this year. That's a product of a partnership with the IU Kelley School of Business and Fairbanks School of Public Health to basically bring together a landscape analysis of all of the private sector health equity strategies that have been tried in workforce spaces across the country, take the evidence-based successful initiatives from that landscape review and make recommendations for what companies can do within their own workplaces. And the heart of these recommendations is to put something in here that any company of any amount of resources and in any size can really latch on to and begin to implement. So just one example from that playbook, which thanks Casey, she's dropped that in the chat for you all to review, focuses in on infant maternal health strategies. So the way this is designed is to say, we know that some of our Black and brown workers face disproportionate challenges when it comes to race, and that has real world impacts on their ability to succeed in the workplace and to make a prosperous life. And so these recommendations are built in such a way that they can be employed and launched for your entire workforce, but are built around the challenges that we know are faced by our Black and brown employees. So the structure of the playbook goes from good to great and basically gives a continuum of recommendations that employers can launch within their own companies. Again, what we wanted to do was demystify this, show the ROI, create recommendations that companies, again, of any size can use, and yet it's not enough just to make these best practices public. What we really believe is necessary is to then provide the subject matter expertise, the consultation support to take it from a report that lives on a shelf to recommendations and strategies that you all can actively implement within your own company. So that is what the BEI Workforce Pilot will aim to do. Stacia, back to you.
Thank you. Tiara, next slide. So what can companies expect from this 2-year cohort pilot program? It is organized in 5 stages. The first stage being companies who are participating will take a survey mainly to determine a baseline for some of your employee outcomes and what, if any, employee well-being and racial equity initiatives you already have within your organizations. And this will be really important for creating workforce profiles, which later will help you prioritize which best practices are important to your organization. Stage 2, we'll start with a kickoff. This is a time for all the cohort companies and their project teams to come together, get to know one another, celebrate their participation in this pilot, but then also talk about some of the results of an aggregate of the survey results so that you understand where you are overall as a cohort, where you fit within that cohort, and then also to talk at a high level really about some of those best practice recommendations. Also during this stage, you'll be introduced to a transformation consultant who has expertise in change management and will help you throughout implementation phase as well. Stage 3 is when we'll invite community-based organizations as local subject matter experts. They'll be there to support you with technical assistance and on-the-ground support throughout your journey of implementation. And they really have been doing this work, some of them for decades, and are really key to what you'll do going forward and creating some of your implementation plans. So in stage 4 is when we actually finalize the company action plan to implement early strategies within your companies. And again, those local subject matter experts will be with you the entire way, as long as also with the transformation consultant the whole way to help you and walk you through. We understand it's not just about telling you what some of these best practices are, but really build that support along the journey and help you deepen relationships with some of our community partners. And then stage 5 is really about evaluation. We want to make sure, both through qualitative listening sessions with participating companies, but also through some quantitative metrics related to the implementation plans and early indicators for success of employee outcomes within your companies, and understand where we are. This will also give us a baseline for whether we need to refine the program for future cohorts and learn how we can scale the program. And so that, in a nutshell, is really what you'll be doing over the 2 years. I want to say a note about the project teams. So we do want each company to assemble a project team headed by their project leader. And this will more than likely be the senior human resources executive within the company. And then also have an executive sponsor team as well, consisting of the CEO, Chief Operations Officer, and Chief Financial Officer. Together, they form the project team that will be key to implementing your action plans for each company. Project leads, we do anticipate committing about 10 hours a month, and then the executive sponsors about 5 hours per month over the course of this 2-year program pilot. So now I think we'll turn it over to Taylor to answer any questions you may have. Please, if you have questions, don't be shy and put them in the question and answer chat of the Zoom link that you have, and we'll take any questions you have. And Taylor, did I forget anything you want to add to the conversation?
You nailed it there, Stacia. And while questions are coming into the chat, I'll just say a couple of things. One is we wanted to host this member town hall, and you all know this. You're our members and supporters. You're the reason why this work takes place. Therefore, when we announce new programs like this, we always want to make sure that you guys get the sneak peek of what this program is going to look like. So today, the interest form and FAQ document that goes deeper into detail on all of the information that we've thrown out to you today will be released. You all can submit your interest to be part of this 30 company inaugural cohort. And then in the next couple of weeks, that link is going to go public and be available to any company around the Central Indiana region. So we give you all a first crack at it because you're our family. You're the ones who support us, and we so appreciate your membership and your partnership on this work. A couple of other things as we think about the value proposition of the Business Equity for Indy initiative in general, but especially when it comes to this work, really what it comes down to is articulating and supporting the implementation of equity strategies, but also making really clear that we think equity strategies are not only the right thing to do, but a central component of what competitiveness looks like in today's economic and business environment. So the recommendations in our playbooks and from all 3 of these task forces are not only helpful to a company whose values really are on advancing racial equity for their employees and their communities, but also in helping to enhance your competitiveness as a company. And finally, I know we threw out a lot, so always feel free to reach out to either Stacia or myself and to, again, submit your questions through the email link that's here on the slide, and then also through the Q&A document. We've got one question.
We do have one question. So this is, I think you may have touched on it already, but is this initiative focused on increasing diversity in the workplace in Indianapolis, as well as, I think, building awareness on business equity for Indy challenges?
Absolutely. I'll take a crack at that, and then Stacia, feel free to fill anything in that I've missed. So Geneva, the way that this is structured is to take basically a focus on one of the #1 challenges that any business in our environment today is facing, which is, what do you do about the talent question? Hiring is more difficult than it has ever been. Retention with the Great Resignation is more difficult than it's ever been. And there's certainly a multiplier when it comes to companies that are really working to diversify their teams. So the hiring hiring and promotion task force of business equity for Indy has really been focused on, once you have candidates in your pipeline and you have hired them into your company, how do you do that in an equitable and effective way? And then how do you grow those folks throughout your organization? Learning and talent has been focused on our educational pipelines as a community in a central Indiana region, and ways that we as employers can plug in with, can help to enhance, can invest in those pipelines in a way that benefits our community, our individuals around us, and the company itself. And the Impediments to Health Task Force is focused on, once folks are in your companies, once folks are a part of your organization, what does it look like to invest in them to support their success through some of these workforce health equity strategies. So that's a lot of words, but basically it's a get them, keep them, grow them strategy on the talent side that BEI helps to enhance. So that's the way that we're thinking about it.
Yeah, and the only thing I will add to that, Taylor, is essentially our framework here is about, when you try to solve problems for those that are closest to the problems, it really ends up helping everyone. And one really great example of that is the curb cut effect. This is where the disability community really advocated on behalf of some of their challenges to get curb cuts on each of the sidewalks to help them either with wheelchair access or just anything, any disability that they were experiencing. And what we found out was, once that happened, it didn't just benefit that community, but almost everybody, from mothers with strollers to elderly walking, even to children with bicycles. And so that is really the premise behind what we're trying to do here. There's another question about the Six Sigma Racial Equity Initiative. Yes, I'm familiar with it. I'm actually a graduate of that. And I think that's a great point that we should connect with them as well. So thank you so much for that. One other question: if we're already working with a DEI consultant, can this program support our work that's already in progress?
That's a great question, Jennifer, and I would say absolutely. So the way that this program is designed is to essentially articulate some of the strategies that we've been able to uncover, but then work with company leaders to put together a specific implementation plan for your firm. So if your firm has already engaged a DEI consultant and your work is ongoing there, I would say that implementation development process can absolutely be integrated with work as it's already happening. So the first stage of the program will be essentially doing some surveying and some touch points with the companies that are in the cohort to essentially say, where are you on this journey? Are you starting from zero? Are you starting from, we've been working on this for a couple of years, and how best can the program come alongside you and your work and help to enhance it? So 100% yes on the working with the DEI program internally. Got one more question here. Would you be willing to accept chairpersons of an organization's DEI affinity group in lieu of a head of HR role? I think that's a great question. The way that we have structured this is to really make sure we put a premium on company buy-in for the program. We really want to make sure that leaders who are going to be decision makers at the company are on board, are committed to the goals of the program. So I would say internal DEI affinity group connection is really, really important, but we would really encourage companies to have their HR leaders represented on their project teams. Any other questions? This has been really great. Those are phenomenal questions and get us a little deeper into some of the meat of the program. Any other thoughts you guys have?
Again, we know we threw a lot at you, but definitely wanted you to understand what to expect as you apply for the program. Okay, one last question. How will you measure outcomes?
Great question, Geneva. So the way that the program is structured is we create a baseline for each of the companies via the survey stage. We'll be working with companies to develop a set of priorities, basically recommendations that they select from each of the best practice packages that have been put together by the different task forces. Those priorities will feed into the implementation plan. So that process will be all about developing how are we going to measure this. As far as the programmatic goals, basically it would be once the company has selected their 3 to 5 priorities from those best practices lists, we want to basically do a percentage grade on how well they fulfill their own goals, how well they fulfill the recommendations of implementing those programs within their own company. But Stacia, do you have any other thoughts on that? Anything else I missed on the metrics side?
No, you covered it. And what we can also do is let you know kind of where we're looking to measure success in each of the stages along the journey to make sure we're headed in the right place. I see a couple others. No, thank you so much, Geneva and Paula. Any other questions? Again, we will send this link out to everyone who is in attendance today. We'll send it out to our membership. And if you do have other questions, feel free to always email either myself or Taylor.
And to say a quick word on timeline, as we said, you all will get a follow-up email to this town hall with an FAQ document covering in text a lot of the information we've given you today, and a link to the interest form, which is your application to this program, and finally a link to the healthcare or the BEI health playbook as well, to give you a sense of what some of these recommendations are and where we're headed with the program. To say a word on timeline, again, you guys are going to get this before the public does, so you get that link in the next couple of days. We will be closing cohort recruitment at the end of the month in August. So if you all are interested, please do fill out that interest form by the end of the month in August. And we are really looking forward to partnering with you on this program and getting more companies engaged in the BEI effort. With that, thank you so much for joining us this morning. Thank you again to both Kyle and Claire for your financial support, for your guidance, for your leadership, and for your comments today. We hope you're all doing well, and we look forward to seeing you again soon.